Good morning to all. Myself, Dr. Swapan Bacher, Assistant Professor, Netaji Subhash Chandra Science College, Mulchara. I will teach you about fungal diseases in fishes. See, as fish is edible, so if it is infected by fungus, then it causes different diseases in the human being. So, we will study about the characteristic of fungus. See, fungi are member of the kingdom Thallophyta. Fungi are colorless. That means no chlorophyll are there and heterotroph. Fungi have eukaryotic cell, fungal hyphae, or it is called mycelium. See, cell wall is made up of chitin and reserve food glycogen. Fungus are responsible for serious and economically important diseases in fishes. First, fungal infection noted in fishes by Adrian in 1784. See the classification of fungi. Myxomycetes, psyllium mold, Phycomycetes, true fungi, Acetomycetes, true fungi. Then Basidiomycetes, it is also true fungi. So this true fungus, it is called Eumycota, and Deuteromycetes, false fungi. So these are the classification of fungi. Now, mode of infections. Fungal infections are most common diseases see in temperate fishes. Poor water quality can also increases fungal infection in healthy fishes. Poor hygienic condition in pond also increase fungal infection in fishes. See, fish that are injured have also spread diseases in other fishes. Decomposing organic material in pond also spread fungal diseases in fishes. So these are about the mode of infections. Now, most fungal infection attack the external tissue and few fungal infection will infect the internal organs. These are like gills, liver, kidney, tissue, spleen, and gonad, etc. All fungi produce spores, and these spores spread diseases. See, most common fungal diseases are saprolaginiasis, that is the ectoparasitic disease. Then bronchiomycosis, endoparasitic diseases. Ichthyophoniasis, these are also endoparasitic diseases. Aspergillomyces, these are endoparasitic diseases. And shrimp mycosis, these are also endoparasitic diseases. See, saprolaginiasis, it is a fungal disease of fish and fish eggs caused by member of family Saprolaginiaceae, characterized by presence of cotton-like white to gray growth on the skin, gills, or eyes of fishes, or in fish eggs. See the causative agent. Saprolingia parasitic, Saprolegnia declina, and Achila hopperi are the major etiological agent of saprolaginiasis. Next, this slide shows mode of transmission, how the transmission or the disease is spread from one fishes to another fish. See, direct contact between diseased fish or fish eggs or healthy ones. Next, indirect contact through several sources, including the water supply, transport vehicles, movement of staff between aquaculture facilities, and farm equipment such as nets. Now, clinical signs. See, the appearance of cotton like. If we observe the fish body, it's appear cotton like structure, that is white to gray growth on the skin and on gills, fins, and even on eyes and eggs of fishes. See, in severe cases, 80% of the body of the fish is covered with fungal growth. Now, see in figures how the fungal hyphae and the fungal growth on the body of fishes. See, in early infection, skin lesions are gray or white in color. Next, lethargy of fish and loss of equilibrium. Infected eggs are opaque in color with growth of fungus on egg surface, lead suffocations and become good medium for growth of the fungi. Diagnosis. How we will diagnose these diseases? See, observation of a cottony or proliferative growth on the skin or gills or any other infectious places. See, direct smear from fungal growth, presence of long, branched, non-separate hyphae help in diagnosis of saproligniasis. See, next diagnosis, that is isolation and identification of saprolignia using cultural method. Next slide, we will see the treatment and control. How we can control these fungal diseases. See, first point, that is avoiding damage of skin during transplantation of fish. Second point, right kind of food. That means without infected food. We should supply the food that should not be infected by fungus. Third, overcrowding of fish must be prevented. Next, preventing the introduction of new fish to the fish farm until known that fish are free from diseases. Next point, that is disinfection of the equipment, or we can sterilize the equipment like utensils and the net also. See, bronchomycosis, it is called gill rot. It is a fungal disease involving gill tissue affecting most species of freshwater fishes. Now, the causative agent, that is bronchomycosis sanguinis. It grows mainly in the blood vessels of gill arches, filaments, and in the gill lamellae also. Bronchomycosis demigrans. This fungal species is found in the parenchymal tissue of the gills. The fungi grow at temperature between 14 degrees centigrade to 35 degrees centigrade area. Now, mode of infections. Fungal spores are transmitted by water to gills. These spores adhere to the gills, germinate and produce hyphae. The hyphae penetrate gills epithelium or within the blood vessels of gills depending on species of fungi. Now, clinical signs. Fish becomes weak in movement. Second sign, that is, fish do not react to the approach of man and can be caught by hand. Now, see, the figure shows how the gills are affected by fungus. See, there are respiratory distresses in infected fish and do not allow the air. Next point, that is, fungus develop on the in gill tissue or penetrate the blood vessels, causing obstruction, congestion, and necrosis of gill tissue. Next, gill may be appearing red from impaired circulation. See, diagnosis, clinical signs, microscopical examination of wet preparation from infected gills. Next, isolation and identification of the causative agent. Now, treatment. How we treat these diseases or fungal infections? See, strict sanitization and disinfections are essential for disease control. See, dead fishes should be collected daily and burned or deeply buried. The third control, that is, pond with branchiomycetes should be dried and treated with calcium oxide. We can see that is क्विक लाइम, जिसको हिंदी में चूना बोला जाता, और the doses are like that: 2 to 3 kg copper sulfate per hectares of pond we should spread. See, disease fish can be treated with melasite green. It is the medicine at dose like 0.1 milligram per liter for extended period of time, or we can use 0.3 milligram per liter for 12 hours. Next point, that is, transportation of infected fish areas to non-infected areas must be prevented. See, regulating the feeding rate during warm weather. Now, another disease, that is ichthyophoneosis. It is also fungal disease. It is the fungal disease of both freshwater as well as marine fishes. Disease characterized by rough or granulomatous of skin and white to grey white lesions in the internal organs and different parts of the body. Now, causative agent. See, Ichthyophonus hofferi, obligate parasite, spherical or oval in shape. Color is yellowish brown and has granulated cytoplasm. The fungus live as an intracellular parasite in the tissue of various organs. The optimum temperature, that is 10 centigrade, growth appeared within 7 to 10 days after inoculation. Now, mode of transmission. See, oral route. Ingestion of infected raw fishes or fish product or other food transmit diseases. Next, second, skin abrasions or damaged gill help in transmission of the infections. Third point, that is carriers help in spreading the infection through fecal discharges. Fourth mode of infection, the disease can transmitted by contact between disease fish and healthy ones. Now clinical sign, how we can identify the if fish are severely infected or not. See, fish with slight or moderate infections, there is no external sign can be observed. Second, fish with advanced infection have rough or granulomatous skin. The term sandpaper effect is used to describe the granulomatous appearance. Third, lesions found in the internal organs as white nodules similar to the granulomatous lesion of mycobacterium infections. Infections of liver or kidney leads to abdominal distension and explothalmia. See, infections of swim bladder which lead to damage of it. Fish lies on the bottom of the pond and died. Curative of the vertebral column. Curvature of vertebral column may also occur due to muscle spasm. Now, diagnosis. Microscopical examination of infected tissue to detect the fungi, that is spore. Histopathological examination and isolation and identification of causative agent. Now, treatment. There are no therapeutic procedures for treatment of ichthyophonous disease. Prevention of infection is the best method for control of diseases. See, feeding of raw fish or infected food must be prevented. Next point, any infected fish or dead fish must be destroyed. Another point, that is all the nets, brushes and utensils used around the infected fish must be disinfected at the same time. These are the diseases we have described about, and thank you.